Management of shoulder pain has been estimated to account for 4.5 million visits to physicians and £2.3 billion financial burden each year in the US alone. Shoulder impingement syndrome is estimated to cost more than $1 billion in the US. Arthroscopic acromioplasty, or subacromial decompression, to treat shoulder impingement, is the most common shoulder surgery in the world. In the UK alone, there are over 20,000 surgeries done annually. The premise of this procedure is that smoothing of the undersurface of the acromion decompresses the passage of the rotator cuff tendons through the subacromial space and relieves the symptoms attributed to shoulder impingement.
Our FIMPACT trial was designed to assess the true impact of arthroscopic subacromial decompression using a rigorous placebo surgical control or double-blind design. We enrolled patients 35 to 65 years of age who had shoulder pain for 3 months and clinical findings consistent with shoulder impingement syndrome. All our patients had a history of failed attempt of conservative treatment.
After a thorough clinical examination, any other cause for shoulder pain, including the presence of a rotator cuff tear, was ruled out using MRI. In the theatre, at the point of surgery, patients underwent arthroscopic examination of the shoulder. If this diagnostic arthroscopy confirmed that no other pathology except for shoulder impingement was present, the patient was then randomised to either arthroscopic subacromial decompression or placebo surgery. Only the orthopaedic surgeon and other staff in the operating room were made aware of the group assignment, and they did not participate in further treatment or follow-up of the patient. Overall, 281 patients were eligible for the study, of which 134 underwent arthroscopic surgery. In the end, 122 patients were randomised. 59 were assigned to arthroscopic subacromial decompression and 63 to diagnostic arthroscopy. As shoulder pain is the hallmark symptom of shoulder impingement, the success of surgery was assessed using 2 questions that queried the patient's shoulder pain. The patients were asked to report their shoulder pain both at rest and on activity using a visual analog scale, or VAS. The scale ranged from 0 to 100, with 0 denoting no pain. At the primary outcome assessment time point, at 24 months, 59 patients remained in the follow-up in both the ASD and DA groups and were included in the analysis.
Our results confirmed what thousands of orthopedic surgeons and millions of people around the world already knew. ASD procedure is effective in relieving shoulder pain. Already at 3 months, our patients reported a significant pain relief, both at rest and during activity. And by 6 months, the pain was decreased by almost 50% from the pre-operative level. And this trend continued. At 24 months, shoulder pain at rest was approximately 10 on a VAS scale, and pain during activity was down to about 20 points. The only problem, at least from the perspective of being an orthopedic surgeon, was that the ASD procedure was no more effective than the placebo surgery. The results of our FIMPACT trial show that arthroscopic subacromial decompression provides no clinically relevant benefit over diagnostic arthroscopy in patients with shoulder impingement syndrome. Thus, our findings do not support the current practice of performing subacromial decompression in these patients.